Hello and welcome to Not in Kansas Anymore. This is our second video on healthcare, and we're just gonna break this down real quick. What would happen if healthcare in America stopped being tied to employment, income, or insurance companies? What if every American could go to the doctor without worrying about a bill? In the last video, we talked about the current healthcare system in the United States and why it's so expensive, so complicated, and so difficult for millions of people to navigate. In this video, we're going to talk about an alternative, a policy proposal called the National Healthcare Plan. One of the opening lines in this policy says, "A nation's strength is not measured solely by its economy or military. It is measured by how its people are treated." And I think that idea gets to the heart of this discussion, because healthcare affects every person in the country at some point in their lives. Whether it's an emergency, a chronic illness, mental illness, prescription medication, or simply trying to afford a doctor's visit. The question is no longer whether healthcare matters. The question is, what kind of system do we as U.S. citizens want? The first major part of the National Health Care Plan is universal coverage. The idea is simple. Everybody is covered, not based on employment, not based on income, not based on age, and not based on whether an insurance company approves you. Under this plan, every legal U.S. resident would be automatically enrolled. That means no losing health care because you change jobs, no gaps in coverage, no trying to figure out which plans you can afford or can't. The goal is one system, everybody included. The policy describes it as everyone in, no one out. Now, before we go any further, if you enjoy this kind of information or discussion about healthcare, education, or just public policies in general, make sure to like the video and subscribe to the channel. And I'd most like to hear your comments. Do you think healthcare should function more as a public service, or should it remain primarily private? Also, if you want to read the full National Healthcare Plan for yourself, I've linked a PDF of the policy down in the description below, as always. Now, whether you agree with the plan or not, I think it's important to understand what problem it's trying to solve. Right now, millions of Americans are either uninsured or underinsured, meaning they technically have coverage, but still can't afford to actually use it. The second major part of this plan is eliminating out-of-pocket costs for medically necessary care. That means no premiums, no deductibles, no copays, and no surprise medical bills. And for a lot of people, that would be one of the biggest changes, because right now, even people with insurance can still end up paying thousands of dollars out of their own pockets. Sometimes people delay going to the doctor because they're worried about the cost. Others avoid treatment entirely, contributing to the overall cost for everyone. Not because they don't need care, but because they can't afford the financial risk. The argument behind this proposal is that healthcare should function more like a public guarantee, not a financial gamble. And again, whether someone supports that idea or not, it directly addresses one of the biggest frustrations people have with the current system. The third major idea behind the National Healthcare Plan is simplification. In the last video, we talked about how the United States doesn't actually have one healthcare system. We have multiple overlapping systems. Employer insurance, private insurance, Medicare, Medicaid, the ACA, and the VA system, all with different rules, different paperwork, and different ways of approving care. The National Healthcare Plan proposes replacing much of that fragmentation with one public system, one standard, one billing structure, one set of rules. Supporters argue that this could significantly reduce administrative costs and make the system easier to navigate for both patients and providers, while saving the country almost $500 billion a year. Instead of hospitals and doctors dealing with dozens of insurance systems, the goal would be a more centralized and streamlined process. The policy also proposes a national provider billing portal, a single system for handling billing and treatment approvals. The idea is to reduce confusion, reduce overhead costs, and make pricing more transparent. Beyond the policy details, I think the bigger conversation is about what would actually mean for ordinary people. For someone working a job they hate to keep their health care coverage. For families worried about emergency medical debt. For people choosing between medication and rent. For rural communities that have lost hospitals and access to care. Or for people struggling with mental health or addiction who can't afford treatment. Supporters of this plan like this argument that healthcare should not depend on how much money you make or whether your job happens to provide insurance. And that's really the core philosophy behind the proposal. That healthcare should be treated as a public responsibility, not just a private, for-profit transaction. Now, obviously, the proposal is large, raises a lot of questions. How would it be funded? What would happen to private insurance? What would actually reduce costs? And could something this big realistically work in the United States? Those are important questions, and they deserve serious answers. But before debating whether a plan like this is even possible, I think it's important to first understand what it's actually trying to do. And at its core, the National Healthcare Plan is attempting to create a healthcare system where access to care is guaranteed, not determined by employment, income, or an insurance status. And in the next video, we're going to talk about the biggest question of all. How would we actually pay for it? If you find value in these types of discussions and my channel, I encourage you once again, please like, share, and subscribe, and comment. And we'll see you in 1 week. where we'll dive into the costs of this plan, what it could save, possibly, and what would change for everyone. Thank you for your time. Goodbye for now.